Good afternoon, everyone. Dr. Al Sayed here with a COVID-19 update. And today I actually don't want to talk about statistics and numbers and what the latest figures are. Everything is available online. You can go to the CDC website. You can look at the various departments of health. All of that information is readily available for you. Obviously, the situation continues to be critical and quite grave, but I want to focus on something different, something that's actually very, very important, and that's the impact of the sudden significant changes on our mental health. The social distancing, the quarantines, the concerns about health, the isolated, hospitalized loved ones, the school closures, some people who've lost their jobs, the impending financial stressors some individuals have already started to experience. The anxiety is real. Signs of depression are on the rise. So let's talk about the response to stress in general and specifically stress as it relates to COVID-19. So who's at higher risk of reacting negatively to the current stress? Obviously, older folks and those who are generally at higher risk for complications from COVID-19 for obvious reasons. Those are individuals who are probably thinking that they're higher risk of getting the infection and more importantly, higher risk of mortality or death. Individuals who have underlying mental health issues anyway, whether it's anxiety or depression. Individuals who have prior substance abuse problems, frontline responders to the crisis. So those would be doctors, nurses, EMTs, etc. They're putting in a lot more hours, time. They're putting their lives, their families' lives at risk. So there's a lot of anxiety going on there. Also children, especially the younger ones who may not be able to express their anxieties and worries about the abrupt changes in their lives. So those are the general categories of individuals who are at higher risk. What are some of the manifestations of the increased stress? So how would you know that you have increased stress and perhaps that you're not coping with the stress well? Changes in sleep or eating. So whether you're not sleeping as much or sleeping more than you typically would, overeating, not eating as much, not having a good appetite. Difficulty concentrating, so not being able to complete your tasks at work, or you read and you're not able to focus. Kids not being able to finish their homework, even though school is out. They really should be still engaged in a routine, and we'll talk about that a little bit later. Previously stable medical problems becoming unstable. So, for example, you have high blood pressure, you have diabetes that's been controlled for months or years. And nothing's really changed in your diet or your lifestyle, and now suddenly your blood pressure is too high, your blood sugars are too high. Those could be signs that the stress is getting to you. Increased worry and fear about health, whether your own health, your family's health, your loved one's health, could also be signs that the stress is getting to you, especially if the fear and the worry is not rational. Increased or new onset substance use or abuse can be a worrying indicator that the stress is getting to you. Now, children can have unique manifestations that stress is getting to them. So excessive crying, irritability, regression in behavior. So for example, especially with younger children who've been toilet trained for months or years, and now they start having accidents during the day, they start bedwetting at night. For teens and preteens who were generally well-behaved or generally responsive to redirection, now they start acting out, becoming angry, having outbursts that they typically did not have before. Kids having unexplained pains, so headaches, abdominal pain, joint pains, that just don't seem to have rational explanations. General poor school performance. So although here in Virginia, the academic year has been put on hold until the end of the year, kids should still be engaged in some sort of academic activity. in coordination with the schools, um, you may notice that your kids who were generally performing well are now not performing as well as they typically would have, and that could be an indicator of increased stress. So, what can we do to minimize the stress and its impact on our mental health? The first and the very most important thing is to break the 24/7 cycle of social media and news coverage. It's not healthy. It's not healthy to be glued to your phone, to your tablet, to your computer, to the TV to try and figure out what are the latest statistics, how many infections, how many people died, what's going on. It's just going to add to your stress and anxiety. If you're going to be seeking out information, when you seek the information, make sure you're getting it from reliable, reputable sources. There's a lot of information, there's a lot of misinformation, and the barrage is only going to add to your stress. Secondly, exercise. Your body needs it, our bodies need it, and it's proven to be good for your mental health. So when we say exercise, it doesn't have to be anything crazy. Just make it a routine, even if it's getting out of your isolation at home, taking a 20 to 30-minute walk in the neighborhood. Maintain the social distancing that everyone's been talking about, but get a breath of fresh air, walk outside with your kids, check out, the birds and the trees and, the nature that's outside. But it's a change of scenery. The weather's going to get nice soon out here. Do something that's a little bit different. If you're going to be inside in your house, do some push-ups, some jumping jacks, whatever it is. Get off the couch and move. Your body needs it, and it's very good for your mental health. Sleep well. Can't overemphasize the importance of good sleep. Sleep hygiene, having a routine for your sleep is very important. Getting good, sufficient hours of sleep with no distractions is very important for our mental health. I can't tell you how many patients I see on a regular basis, not just during this crisis, but in my practice all the time, where inadequate sleep is an underappreciated contributor to many cases of chronic pain and mental health issues. So you got to get good sleep. Eat healthy. Um, One of the biggest reasons patients always give for not eating healthy is a lack of time. That, Doc, I get up in the morning, I have to get the kids ready for school, I have a long commute, and then I have to grab a quick lunch during the day, and then I get back home late. I just don't have time to prepare a healthy meal. Well, for many of us, that's not an excuse anymore. You're either working from home, or unfortunately for some, you've been laid off, or you just don't know when you're going to get back to work. At least for now, use the time that you have to plan out your meals, try to be cognizant of where you're eating, eat a balanced, healthy meal, and try and avoid the urge to snack all day simply because you're sitting around without much to do. Rediscover your hobbies. If you had hobbies that you haven't had time to engage in a long time, try and rediscover them or find interesting activities to engage in. Now, the next one here is very, very important. It's very, very important. Stay connected. Stay connected with family, friends, and neighbors. Just because we're talking about social distancing, that doesn't mean we're talking about social isolation. So social distancing is we're trying to flatten that curve, as we've been talking about, flatten the curve of spreading the infection. That doesn't mean that we're going to isolate ourselves at home and we're not going to talk to our families, our extended families, our parents, our coworkers, our friends that we were engaging with, our neighbor just down the road, the elderly lady, checking in on her, make sure she's got her groceries, her medications. We need to maintain that social fabric that kept the community together so we can get through this and get over it together as a community. This is very, very important for our mental health. Avoid alcohol and drugs at all costs. Please, there's no benefit, there's plenty of harm, both physical and mental. If you have an underlying mental health problem from before, anxiety, depression, or otherwise, continue your medications, monitor for any worsening symptoms, and reach out to your physician as soon as you begin feeling any concerning symptoms without hesitation. As far as your children are concerned, make sure you reassure and comfort them that they are safe. They need to hear that from you, even if you're anxious and worried and not sure and stressed out. Talk to them regularly and discuss their concerns. Maintain a routine daily schedule for them. This is especially important given that school is out for the rest of the academic year. So they can't just be sitting around all day with nothing to do. It's going to cause problems for them, and it's going to cause problems for you, and it's going to add to your stress. And engage with them in relaxing, fun activities. And importantly, set an example. Don't allow your stress to spill over onto them. Now, these are general advice and recommendations. Always seek professional help if you feel that your stress levels are impeding your ability to function. Reach out to your physician. If you had a mental health provider, reach out to them. Don't feel ashamed. Don't feel that you're alone. We're all in this together, and we need to feel that we have a safety net to help us get over this very difficult time. As I've mentioned before, try to take advantage of alternative options for accessing medical care, such as telemedicine. And as always, stay informed, avoid panic and unwarranted fear, and be sure to keep an eye on our page as we do our best to update you on the latest. Thank you very much for tuning in.